Good morning, everyone. We present a webinar on a very interesting topic, that is precaution, protection, and practices in medical stores and stockist premises during our COVID-19 times. As we are well aware that cases are popping up here and there, responsible citizens are going to the hospital, but the first stop that any sick person makes is the chemist. Hence, the safety for a chemist or any medical store or stockist person is very, very important. So here we have two experts who are wanting to elaborate on the topic. Can we have the slide, Sana? So first we have Dr. Avinash. Dr. Avinash, next slide. Dr. Avinash is the president of the IMA chapter of Maharashtra. He's a UNESCO chair for bioethics, practicing medicine since 1984, and he has a long list of accomplishments under his name. Welcome, Dr. Avinash. Thank you for joining us.
Good morning.
Then we have Dr. Rajendra Kulkarni, a very dynamic person, a CWC member in IMA HQ, Member Action Committee of IMA Maharashtra, and past Vice President IMA. Thank you, Dr. Rajendra Kulkarni. Thank you for coming. So I request you, sir, to please elaborate on this topic. Thank you, sir. Yes. Thank you very much.
Good morning, everybody. Good morning, Avinash, sir. We are here for chemists, because chemist is someone who is very important pillar of the entire healthcare system, we suppose. It is not only the dispensing drugs against any prescription which he comes across with, but the chemist serves an important part as far as health awareness and health education of patients and the patient's relatives is concerned. So we are working day in and day out with chemists because it is an important part of healthcare system, doctors, nurses, the entire paramedical staff, which includes the chemist. So we are working with chemists, and as an association also, like Indian Medical Association, which is the largest organization of doctors, largest NGO of this country, we are working during this pandemic of Corona, along with Chemist Association. I think Dr. Avinash Bonwe, sir, you are the president of IMA Maharashtra, and right from day one of this work, we have started working along with the Chemist Association. Will you just please, you all had a meeting with Chemist Association present, right?
Yeah. Dr. Rajendra, thank you very much. And first of all, I'll tell you that doctors, the Indian Medical Association is the largest association of doctors, of the allopathic doctors, and most of us are practicing doctors. So we always consider that all the chemists and the chemists, druggists, and medical shops, they're part of our world. They're part of our medical world. And since we are fighting against this deadly pandemic COVID-19, the chemists are along with us, hand in hand, shoulder to shoulder. And I must say that it has been seen that some of our colleagues are not working full time, but I must say most of the chemists, or rather all of the chemists, are abiding by the law and keeping their shops open. So that is a great service. We are always the doctors are given credit for this medical service, but along with doctors, all these my chemist brothers and sisters, they are also working very hard. And I must say the doctors are always treated as corona warriors nowadays, but these chemists, these all friends, they are also corona warriors, because they are also fighting against this deadly pandemic. And it is our duty, our doctors' duty, yes, to talk to them about few things regarding their own safety, regarding the disinfection of the their shops and their premises, as well as some additional suggestions in which way they can help the society. Yeah.
Yeah.
So
sure. all the frontline workers like doctors, nurses, paramedical staff are, as you rightly said, sir, that they are referred to as Corona warriors these days. Even the police, cleaning workers, and even the revenue people, employees who are working day in and day out to keep this fight against Corona effective. They are all referred to as Corona warriors. And of course, as you rightly mentioned, these chemists are also part of Corona, must be referred to as Corona warriors. So this know all about COVID-19. So little bit elaborate on how this COVID-19 came into existence and about history when it started and so. I suppose this is a very new thing, right? Yes, sir.
Actually, Rajendra, all our chemists are really well-read people, and they must be knowing that when we were celebrating our New Year 2020, on that very night, 31st December 2019, the government of China, the Health Department of China, rang up WHO that they have seen a large number of cases which are having pneumonia, and which is rather they are suspicious that some new type of virus must be there. And they also elaborated that is a virus from Corona family. So now this coronavirus was this thing. Corona is a family of viruses, and in which many viruses are seen. They're named as the Corona because it looks like a sun and its rays. So that's why it is named as Corona. And some viruses like this SARS and MERS were there, and they have also troubled us a lot. So, but this was a new child born, and that's why initially the name was given as new coronavirus, and later on it was termed as COVID-19 because it was it was found out in 2019. It was said that this virus, scientists found out that this virus was seen in the bats. And after 2 years, it converted into some different variety, it mutated into different variety. And there was some intermediate thing in which it got transformed, it got mutated. And from that intermediate transformation, it rather entered the human being. Now, in meantime, somewhere in December end and January first 15 days, people were thinking that it directly came from bat or directly came from the chickens and all that. So there was a lot of confusion and lot of some wrong things were treated, informed to general public. And it was said that it is coming from the chickens, from the all these animals. So people were thinking that it is coming from animals, but now it is confirmed that it is a human virus. It transmits from one person to the other, from one human being to the other. And the transmission is mostly by two types. One is directly whenever a person is infected with this coronavirus, he coughs. Some droplets are going out, and those droplets which go into air and in this thing, rather they are sprayed up to 3 feet, sometimes 3 to 6 feet. So if these droplets, that each droplet contains millions of viruses, and if somebody is near to this place, near to that person between 3 to 6 feet, that he may inhale that those droplets and gets infected. And second is, if these droplets, they fall on some objects, like you can say the tables and chairs, or even the counters in your shops, or even on some objects like doors, doorknob. And if you touch with your hands, and if that hand, if you touch again your face, if you touch your fingers or hands to your eyes, your nose, your mouth, then it gets transferred from your hand to your body, and then you get infected. So there are only two sources which are this thing. And why I'm explaining in detail, because if you understand this process, then only you will understand how to protect yourself. So this is the most important thing. And for this, I think most of our chemist fraternity, they know all these things very well. But we have to teach again and again to the people, to the common people. And the very important thing is it's very effective. It spreads very fast. It enters your body, and within 3 days to 5 days, it increases in number. It enters into your body. It gets inside the cells of your body, the tissues of your throat, and it multiplies. The viruses are on the border of living and non-living. So when they are outside, they do not multiply. When they go into a living structure, it may be a plant, it may be an animal, or maybe a human being. This human coronavirus, this COVID-19 is a human virus. It enters through your nose and your mouth and goes into your throat, nasal cavity, and enters the cells and multiplies like anything. When the number goes high, it shows infection. It shows the signs of infection. Then it proceeds to your bronchus, bronchioles, and invades your lungs. And then the person gets severe pneumonia. So this is the usual thing. So our aim is to find out this thing and treat.
What are the general symptoms of this?
Of course. So since it enters through the nose, it's a respiratory virus. It enters your body through your nose, through your respiration, and invades your lungs. It's a respiratory virus. So most of the symptoms are respiratory symptoms. Like you get cold, you get throat pain, you get severe cough, and as it proceeds, you get breathlessness once the lungs and the bronchus is involved. Along with that, since this is infection, it rather circulates throughout your body and you get temperature. So high grade temperature, usually about 38 degrees centigrade. Then this cough and breathlessness are the main symptoms.
So, sir, you were told that this WHO has declared it as a pandemic, and it has declared it in January as a health emergency of international concern. Yeah. And then they termed COVID-19. So the difference in Corona and COVID-19, most of the common people, they have this confusion. So what I understand, let us tell this the entire audience that COVID-19 is the disease, which is Corona infectious disease of 2019, and Corona is the name of the virus, right? And this is a pandemic. Pandemic is intercontinental spread of the disease. And till now, today morning I visited the WHO site. It shows that there have been more than 28 lakh cases to date, and there are more than 1,98,000 deaths all over the world. But even in India, the count is 21,132 active cases as of now, and 886 were the deaths. Of course, the silver lining to this black cloud is about 6,361 fewer. And then it is called a case fatality rate. Then see, even if the number of deaths appears to be more, look at the percentage. Percentage of deaths compared to the cases is quite less. But of course, as you suggested, sir, it spreads very fast. We had this Ebola pandemic, we had this MERS, we had SARS, the swine flu, and all. And but the spread, the speed with which this corona spreads is too high, and it transmits with these two ways, as you explained. So, is there any treatment, awareness, sir, for this disease?
I would, Dr. Rajendra, I would like to add few sentences to your explanation that epidemic is the disease when a person, many people get infected. Many people infected in a given geographical area. That is epidemic. When it spreads from one country to the other, it is pandemic. It all world over in all over the world. Right now, there are more than 190 countries which are involved in this, as you rightly said. And about the figures, it is so fast rising that daily few thousand people are getting infected, and day by day the number is increasing. So it is very vicious. And secondly, what I'd like to add is this disease has got no front this thing and no back. We are not right now. We are not able to gauge it. It was declared as pandemic in the first week of January, but people were not rather sure about the gravity of the disease. And sometimes I feel that right now also we do not know what will the end of this epidemic or pandemic. Now about the treatment. You see the viruses, most of the viruses are different, and right now there is no direct treatment for the this coronavirus, because it is a newly invented virus. So we do not have any medicine, any drug, which will rather either, there are two types of treatment usually. Sometimes there are some medicines which stops the multiplication of the viruses or the growth of the virus. So they stabilize it, and in some conditions they rather remove or kill the virus. They remove the virus or they kill that virus. So there are sidal and static drugs for many of this thing. Our chemist people know that. In HIV, we have still the static drugs. Now, as far as the coronavirus is concerned, there is no drug or no medicine which is available for anything with either sidal or static type. Now, what we treat? Now, remember, virus is such a thing. Most of the time, it enters your body. It takes its own time. It multiplies, and after some time, it goes away. By the time it rather destroys your systems, your organs, your tissues, and it goes away. So sometimes this destruction is less. If you remember, these measles, mumps, all these things. Previously, people used to get infected by measles and mumps a lot of time. Dr. Rajendra must be knowing, and most of our chemists must be knowing, that around 20-25 years back, whenever a January or February used to come, just the temperature used to go high. We used to get a lot of measles cases. But with the vaccination, it goes up. If you remember in that, many a times people never used to give medicines. It used to enter all these eruptions on the face and body, and after some days it used to go off. Just like that, in corona, the virus enters your body. We have to take precaution of the symptoms. There are some symptoms like throat pain, fever. We have to treat initially with the symptom. And secondly, if it complicates few things, like there is pneumonia, there is some bronchial inflammation, there are some other things that we have to treat it. Since it is a respiratory virus, sometimes the capacity of getting the oxygen which is required for the body, the oxygen percentage goes down. So we have to provide the oxygen externally. Then there are some other problems, like suppose some electrolytes are less, we have to treat that. In a way, you have to treat the patient symptomatically. There is no curative treatment for the virus. We have to treat the symptoms and the complications, and we have to monitor all the vital parameters.
So
yes,
that is the most dangerous thing about this. That's why there is so much of hue and cry as compared to the Ebola and MERS and SARS. The corona is very much, the entire world is afraid of corona because it is an evolving disease. There is no treatment. Whatever we are doing is a supportive treatment, right? And what we have to do, or what is in our hand, is only to stop transmission. The transmission is the droplet transmission, because, and those droplets, as you have explained, it remains viable for a prolonged period of time on the surfaces like doorknobs, clothes, and hands. So the main thing to stop transmission are, we are told everywhere, in the radio ads, television ads, on WhatsApp, the hand washing, basic years of it. So will you please explain us what is so much about hand washing? Is there a specific technique of hand washing, and how hand washing is important?
Yeah. rightly you said, Dr. Rajendra, that whatever we do not have the treatment, so whatever is in our hand is to protect ourselves.
Yes.
And to protect ourselves, is it called, if you stop the transmission, you have to break the transmission. The virus is very infectious and it spreads like anything. Very speedily it spreads. So you have to stop that this thing. It is the word which is used by the media is break the chain. You have to break the chain from one person to the other. And that's why all these things are important. So breaking chain, one is, all these keeping safe distance. But as you know, the virus gets transmitted to your body by your hands. So most of the time, the hand washing is very important. And hand washing is not just keeping your hands under the tap water and just rinse it. It is not like that. So the main thing, I'll tell you, a scientific thing. All our chemist brothers are basically the science graduates. So they must be knowing all that. So it is like that. So first you have to open the tap. Open the tap. So use a tissue paper, a plain tissue paper, and open the knob of this thing. Then once the tap starts running, put the either sanitizer or since we are washing our hands, put the soap. If you use a soap with a soap dispenser is a good thing, because using a soap cake, it's better if you use a soap dispenser or the liquid soap. So there is a tap, there is a cap on that dispenser. You have to press that cap with your elbow. Once it comes out, you can press the cap of the dispenser with your elbow. Once the soap liquid comes out, take on one hand, then wash it, then rub it. So there is a technique. Initially, once you take this soap, liquid soap, then take some water, then rub it. So this rubbing involves a few steps. So the first is you have to rub all your palms, then the external sides. External sides also you have to rub. Then the third is you have to use your fingers and rub it. Your tips of the fingers and nails and rub it on this thing. Then the base of the thumb you have to rub nicely, and at the end your wrist. So use it like simple thing. This way, and the last thing, and in between your thumbs. So this takes only 20 seconds. So wash your hands properly, including all these 4 or 5 steps. Every part, the principle is every part of your hand should be rubbed with the soap, liquid soap, and then rinse it properly, wash it properly under the tap water, and again close the tap with the tissue paper and dispose that tissue paper properly. So these are the things you have to see. And I'll tell you one thing, just to think that you must have attended a lot of birthday ceremonies. So we wish everybody that happy birthday to you. That happy birthday to you, Rajendra. Happy birthday to you, dear Rajendra. Whatever we say takes 20 seconds.
Yes.
It's a 20-second song. So it's very well remembering. You can entertain yourself with using that song. Once the song is over, your hand wash should be over. It's like that. So 20 seconds means you should not look at your watch or your mobile second clock. So this is the thing you should do with this thing, and you have to do it every now and then, every 2 hours, or in between. If you want to touch your face, if you want to see, this is the summer season, you may be getting perspiration, or sometimes you feel that this. We have got habit, without unknowingly we do it. Unknowingly we touch your nose. Even we have seen some of the television celebrities, some actors, where they are giving interviews, they are touching this thing, just keeping their hand over their hair and all that. So all these things we do it without knowing. So these things should be avoided. So before that, you must wash your hand. Then for as far as the chemist point of view, every time when you touch the medicine and this thing, you keep on doing. While you are dispensing your medicine, you should not touch your hands to your face. While you are doing the bills and taking the money and all that, you should not touch your face. You are doing all this with your hands. So remember, the hand washing is the basic principle, is the first step of the this prevention against this coronavirus, prevention against getting infected. Yeah.
Okay. Breaking the chain of transmission, hand wash serves the main important purpose. And very interestingly, you told this that you have to do it for 20 seconds, and how to count those 20 seconds. Happy birthday to you, Rajan. That is very interesting. Here I remember one mnemonic for this hand movements. It's the mnemonic is Suman K. You know, Suman is any girl's name, Sumank. S is it is straight. U is ulta, that is the, then M is middle, A for angutha, A for angutha, N for nails, and K for kangan. So this is how you should remember the movements. This is for the, just to remember. That's how 20 seconds and how.
Rajendra, I thought.
Hello.
Yeah, Rajendra, I thought that Suman K is the name of some Suman Kulkarni or something.
No, sir, it can be Kashyap also, Kaushik also.
No. Yeah. Okay. Okay. Carry on.
So it is for 20 seconds every 2 hourly. But see, sir, in these metropolitan cities, in small setups, that is the minimum 120 square foot space is required for a medical shop. And because of the scarcity of place, they have to just manage with that. There may not be any tap water. In fact, here I remember one more thing in our residency days when we used to visit our NICU, neonatal intensive care unit. So we used to wash these hands. That time only it was taught to us. And that time it was said that soap, water, and common sense are the three major important disinfectants. This should be remembered by everyone. Soap, water, and common sense. So, if there is no facility for washing hands, there is no tap water and no soap in a shop, it may not be possible in everywhere. So, what is the alternative for a chemist where hand washing is not available?
Yeah, the first thing, if there is no tap water, you can keep, you can get a lot of those buckets with the tap on that. You can use that, keep a bucket inside and one bucket full of this thing with the tap. But of course, as you rightly said, in India is at many places you have scarcity of water, and secondly, this is a summer season. We have to use water with caution. So if you use this sanitizer, a proper sanitizer for this, that will be really useful. It will be substitute for your this thing, hand washing. But of course, you have to rub it not for 20 seconds, but you have to rub it all over. Remember, the every millimeter, I won't say inch, every millimeter of your hands, right from your wrist to your tip of your fingers, should be clean. And you should repeat it after, say, every 2 hours or 3 hours. And one very important thing, that once you're using the sanitizer, but before taking your food, you must wash it properly with the soap water. That is very important thing. I will request to all our chemist brothers that you keep one sanitizer for yourself and also keep one for your staff as well as for your customers. That is very important. And very, very important, initially, it was not available, but now we are observing that many sanitizer products have come. Just confirm it is really scientifically prepared and then dispense. There are some, as you all know, that sometimes the spurious drugs are, rather they may be coming to you for sale. But my request will be, just get confirmed that it is scientifically prepared with the formula, that you know better what should be the contents, and all these things should be there, and make it available. Because it is your duty, it is our duty to give good medicines. Just like that, it is our chemist's duty to give a good sanitizer, which will definitely be a good medium for cleaning their hands and protect themselves. So make it available and make the good products available. That will be our request.
So like whenever in marriage, are welcome by handing over a rose. I think every chemist should welcome his customer by putting some hand sanitizer on his hand, so that it will be a cleaning of hands, and the importance and the message will also go across to the patient and their relatives. The second point in this breaking of chain of transmission of corona after hand washing. Of course, hand washing is very much important. Another important thing is social distancing. So what is social distancing? How much distance?
Yes.
And how?
Yes. So Rajendra, it's a very good point. Initially, I told you how it spreads. There lies the answer of this question about the social distancing. But I must mention one thing, that last week the World Health Organization has declared that don't use the word social distancing, use it physical distancing. Physical distancing, because it is distance between two bodies. Social distancing has got different meaning. That's what some people pointed out. So we'll be using the word henceforth as the physical distancing. So the principle is it spreads from the cough. All these droplets which go through the cough, they go up to 3 feet or sometimes 6 feet. So there should be distance minimum 3 feet between two people. This is called as, this is the principle of social distancing. Just now I coughed. So we must ask everybody, because it spreads from the mouth. So you have to use mask. We'll talk about the mask later. But you have to use the mask, and there are some coughing etiquettes. You have to cough either on the inside of your arm or the inside of your shoulder. It's like that. So this is the right way should cough. Usually what we do, we cough on your hands, or we just cough directly. So it should be prevented. Even if you are wearing a mask, you should cough like this. That is very important. So social distancing, we have to observe everywhere. A person, suppose now you are standing in your shop with your staff. Even there should be 3 feet different distance between your staff and yourself. Then those customers which are coming, I've seen that most of the shopkeepers are using this technique, this physical distancing. So ask them to stand in a row with 3 feet. They should stand 3 feet apart. Many times I've seen, initially it was very difficult to ask the people, but now it is rather people are accepting this physical distancing principle. Even in our clinics also, if the clinic is full, after this thing, we are asking our patients and their relatives to wait outside the clinic with the 3 feet distance between them. So this is social distancing, and this is another point for breaking the chain of this virus spread, virus transmission.
So after hand washing and social distancing, the next point is we just touched about that masks help in preventing the spread of infection, and there are n number of masks available. And so what are the common types of masks available? Are there any specific recommendations as far as who should wear what type of mask? So it's like we doctors need to have N95 type of mask, but you can see that there is shortage and we are not getting that. And when we go out, we see that there are some common people roaming around with N95 mask. So what is the recommendation, scientific recommendation? You just please elaborate our chemist friends about what are the types, because they are asked by lay people what type of mask available and what is to be used. So please.
It is a simple thing. One is the person who does not have any risk, but a remote chance of getting infection, should use a simple cotton mask. The person who is having chance of getting some sort of infection should use a surgical mask or a 3-layered mask, surgical mask. And the person who has got highest chance of getting the infection should use the N95 mask. The N95 mask, people always get puzzled why it is called as N95. So all these masks are they are the barriers between those sprinkles or those showers which you are getting, or the droplets you are getting from the other person when he coughs. It also is a barrier. If you cough, it does not spread. It remains inside. So there are these 3 types of masks. The simple is the first is the cotton mask. Should be made from a cotton, a square outside and some ribbons on the back. So you have to tie it. You have to if you use 2 cotton masks, one over the other, it is always better. So right now we are seeing that many of the people still do not use masks. Even we see on road all over India that especially the women, especially the lower economical strata, they are using just some sort of their pailu on their face of their sari, or sometimes the simple the top this thing they take it. Most of our men, they use just a simple handkerchief. That is not sufficient. They should use a proper mask, and everybody should get habit of you wearing mask, because this corona epidemic and all these things will be there for a long time. Secondly, this cotton mask should be clean. Every day you should keep it for washing. If you want, you can keep in a disinfectant solution for 10 minutes or more, and then just wash it and keep it for drying, but use it daily. Some people ask that whether we should iron them. Okay, it's your choice, because the ironing and all this thing is not the same. But very important thing, if you are using, all those people who are having less risk can use cotton mask. Those people who do not have any symptoms are going for the shops, going for these routine grocery purchase or vegetable purchase, should use them. Anybody who's going outside for some primary work, some office work, they can use this cotton mask. Those bank people and other people, those who are having less chances of getting contact with the infected people, should use cotton mask. So cotton mask, even the government, the US government has made it compulsory to use the cotton mask for everybody. It is our suggestion that if you use two masks over this thing, that will be useful. The second is surgical mask. That can be used by many people who are having some more chance. I will suggest that our chemist brothers should use the surgical mask, because there is always chance. You are getting patients for the purchase. You may not know that the person may be infected, because right now we are having asymptomatic people who are getting this corona positive. So this simple surgical mask can be used by chemists or their staff. And secondly, all our hospital staff, they can use this thing. And those who are not seeing or examining the COVID patient, the non-COVID patient, they can use the surgical mask, the staff. But the doctors, whether he's treating a COVID patient or not, he has to use a N95 mask. Now, why it is called as N95 mask? Because it filters all those droplets from its front side. The N95 filters the 95% of the droplets. So 95% of the droplets are rather filtered through this N95 mask, and they should be used only by the doctors or the health workers like that, or those who are going near. Suppose somebody is having this thing at home quarantine, he should use this N95. Their family members or those who may go in contact should use. But otherwise, all other people should use the cotton mask. Secondly, there are some other categories also which filter around 100%. N100 is also there. So all these are and should be reserved for the doctors who are treating COVID patients or treating patients. So this is very, very important. By the way, I will request all the chemist brothers that they should make these masks available in their shops, all the 3 types of masks, and they should see that this N95 mask should be purchased by the doctors themselves, because right now we are also having this difficulty that we are not getting a good amount of N95 masks. Even these N95 masks we have to change daily, but because we are not having sufficient number with us, the people are using one mask, keeping it hang for 4 days and reusing it after 4 days. So there are a lot of adjustment we are doing. But our request to all the chemists, this thing, that if you make this, even the cotton masks and surgical masks available, and even whenever a person comes, as per his requirement, if you give rightly advice and give it to them, and I know that you people are very knowledgeable, you know all these things, but if you make it available, you have a good number of vendors and this thing, you make it available, all these simple cotton masks, all 3 types of masks, and distribute it, of course, with the proper price and this thing. That is very much need. Right now we are not having a good number of cotton masks available anywhere. So these are the things. Mask is one of the very, very important thing for the breaking the chain of the transmission, the viral infection, and it is very important. It is going to stay for a long time. People should remember that whenever you are using any type of mask, don't touch the front side. Don't touch the front. It is filtering this thing. So if you touch the front side, then you are going to infect yourself. Your hands are not clean. Your hands are having some viruses. You are diseased. So many times I have seen that some of our very elite people, they are using N95 mask and they are touching the front side. You can observe this on so many television interviews, on television shows, that people are touching the very good people. They are touching their front side. That is not advisable. You have to just get hold of those ribbons outside and then take it out and keep it out. We doctors are trained for all these things during our surgical term, in surgery training. That's why we know all this. So this is very important. See, the mask is your one of the personal protection equipment. It is a PPE for common people. You have to, it's a scientific thing and you have to use it scientifically. Just like hand washing, this has got some principle behind it. So who should use which type of mask, how to use a mask, how to clean a mask is very, very important.
So I would like to add just one point here, that the difference between this surgical mask and the N95 mask, that in N95 you breathe through the mask, whereas in cloth mask and surgical mask the air goes from the side of the mask. So if you are using any relative or a caregiver of a COVID patient using an N95 mask, you should see to it that the mask is snugly fitting the nose and the mouth. So that has to be remembered.
One more important point, it should cover the nose also. Many times we see that people, because of this summer season, cannot breathe, they get perspired and only the mouth is covered. No, you have to cover your nose and mouth both.
And another added advantage of wearing a mask is you inadvertently touching your mouth and nose, that is prevented. That is another.
Right.
Similarly, another equipment, PPE, that is personal protection equipment, is hand gloves. Putting on hand gloves also will prevent your touching your mouth and nose. So what else? That is hand glove, using of hand gloves. So we are coming to the next point. After hand washing, social distancing, mask, and the fourth pillar of breaking the chain of transmission is hand gloves. So please guide on the use of hand gloves and how the tools will help in breaking this chain by using hand gloves.
Yeah, nowadays what we see that 2 types of hand gloves are used. One is the surgical disposable hand gloves, which should be used by especially the doctors or even the chemists. They can use it. The second is people are using the reusable mask, sometimes the plastic one, and sometimes even the I've seen the many of the police officers are using these cotton gloves. Doesn't matter. It also gives some protection that whatever the transmission of the surfaces you touch all these with your hands can be prevented. And if you are right now, as rightly you said that if you are wearing you're wearing the hand gloves, then you yourself prevent to touch your face and nose and all that. So it's always very important to use a glove. Disposable surgical gloves are available in plenty this thing at every place. So those who are handling the patient's fomites or patients this thing directly have to use gloves, like doctors and all those hospital workers. Even the chemist can use these hand gloves. But even the alternative for other people who are going to go out using the cotton gloves or the reusable plastic gloves are also very, very important. Only thing, you have to keep them clean. If you are using the disposable, you have to dispose it properly in a our dry waste this thing. And if you are using these cotton gloves, you have to wash it properly. You have to disinfect it properly.
Then after this information about breaking the chain of transmission, how this information can be used by chemist at his shop? For example, hand washing, as you said, they give hand sanitizer, social distancing, and using hand gloves. In fact, I will recommend here to our chemist friends that they can ask every customer to wear a mask.
Right. At some places, even if the glove, if you are not using the mask, you will not be dispense the medicine.
You will not dispense the medicine.
Yeah.
If you will ask the customer to go back, wear a mask and come, then only I will on.
Yeah. Like we have rather all doctors, we in IMA, we have made it compulsory for our patients to use mask, because it is not only protect themselves but protect ourselves also.
Yes. So this is all they will take care of. But now the concern that I am getting certain questions from our audience. One of the questions.
One more thing, Rajendra. What I like to advise all our chemist friends, that how to disinfect your shop. That is very important. So it's a simple thing, very important. All these counters, all these things should be cleaned with whatever disinfectant you are using. Sometimes Lysol is good thing, or some people are using some phenyl solutions. There is no need of using something very costly. The routine disinfectants are equally effective. So you have to clean it, your counters, your floor. All sometimes you have these collapsing doors. You have to clean it daily with a known disinfectant. Then again, after 2-3 hours, you should clean your counters also. So this should be observed properly. Secondly, just remember, once you or your person cleans the counter, you have to wash your hands. All these things you have to remember. If you use a cotton mop, it is okay. If you are using a machine, it is okay. If you are using some different types of mops, it doesn't make any difference. But also disinfect all these things properly. All these mops or these things should be cleaned properly and kept in a different side. One more very, very important thing which I am always asked, that how to handle the cash currency. Because a lot of people have some awe about that. So one thing, if you are having this e-payment or other things, this credit card is okay. That is always better, because it prevents the touch of the hands. So online payment, mobile payment, or whatever this thing, Google Pay and all these things can be used, should be used. Try to do it. But most of our people, who are from the lower middle class or from the economically lower class, they do not have all this facility with them. So for that, we have to accept the cash. So it is advised that if possible, use gloves while handling these notes. Keep those in your counter. Whenever you count it, don't put your this thing. Is always a habit of so many people that counting, they just touch their tongue or even the lips. So don't do that. And after counting or after handling the cash or the currency notes, you have to wash your hands properly. No need to disinfect the currency notes. I have seen hundreds of people are washing the currency notes. They're ironing them. It is not necessary. Just remember, it's your hands which you should take care of. This coronavirus does not jump from the currency note to your body. So remember that. Accept currency note, keep them properly. If you want, you can keep a box for that. You can use your counter or your drawer for that. But clean that drawer or whatever you are using for this. So that is very important. As far as possible, try to use this online payment or whatever the new methods are there. That is very important.
So, sir, when we had our meeting with the Chemist and Druggist Association, right, in the beginning of this pandemic work against Corona, we had appealed and instructed all the chemist friends that don't give any simple medicines for cough, cold, which are usually called as over-the-counter products. Because in this scenario, in this Corona scenario, we have appealed to them that instead of dispensing those over-the-counter products, ask them to visit our IMA-run fever clinic, respiratory clinic, or community clinic, so that we cannot miss out on a single case of Corona.
Yes.
Coming
we had Rajendra, Dr. Rajendra, we had a meeting from our IMA Maharashtra with the Chemist and Druggist Association of Maharashtra state. And I personally requested them that, see, you cannot prevent people from taking OTC drugs.
Yes.
So even if you give them, and they cannot say no, like we doctors cannot turn out the patient. Just like that, our chemist friends also cannot say that I won't dispense. So even if you dispense him something, so ask him to go to a doctor or to a fever clinic run by IMA or by government. So that is very important. So after that, our chemist association gave this notification to all the members. But even the government of Maharashtra, they went one step ahead. And they have said, they have asked all the chemist friends to give the names of all those people who are taken fever medicines and report them. That is one thing. So take care that whenever you this thing, don't give, rather try to persuade the person to report to a doctor or take medicine from the doctor. Because remember, the person who is taking some fever medicine may be or can be a suspect of a COVID positive case.
In this same breath, let us now talk about different drugs which are of more concern for the chemist, like chloroquine. Hydroxychloroquine tablets were supposed to be useful for preventing getting infected with corona. Can a chemist just sell that hydroxychloroquine, or is there, I will say, is there any role of hydroxychloroquine in preventing that? Please.
Right. Dr. Rajendra is very important in not only the doctor's point of view, but also the chemist's point of view and all the society at large. This chloroquine and hydroxychloroquine issue was much hyped because of the statements made by the President of United States of America. And after that, even the government of India also issued the notice. The ICMR clearly came out with the guidelines that the hydroxychloroquine, which is should be used only for two cases. First is those who are in direct contact with the COVID positive patient, corona positive patients, who are direct contacts. And secondly, the health workers. So this was the clear-cut instruction. Secondly, it has to be, the dose has to be taken 1 BD, on the first day for 1 tablet twice a day, and it should be repeated the 400 milligram once a week for 3 weeks for the contacts and 6 to 8 weeks for the doctors. It should not be given to the people below the age of 15. It should not be given those who are having some reactions or blood dyscrasias. They should not be given the people who are having any liver problem or any renal problem, kidney problem. And most, a very important thing, it was told that it should not be given without a prescription. But what happened when the news was hyped, it was broadcasted all over the media, like people were saying that a new medicine has come out for the this corona, and it was so, people were so much excited that within a day's time all the hydroxychloroquine stock was over. Right now, I've got at least 5 patients who are on HCQS for a long time for the rheumatoid arthritis, and they are not getting it. So my request will be, don't dispense again without doctor's prescription, and be sure that doctors are not going to use it, because its effect is not proven. It is still under evaluation. Even for the protection or for the prevention, even the FDA of America has given permission for a temporary, it is a temporary permission to the US government. So our request is, don't dispense this thing without a prescription, and always advise these patients who purchase this thing that use it cautiously, because it has got definite guidelines. And right now, even the government is giving it, distributing it freely in Mumbai, and the dose is advised. But many people are coming with the vomiting, gastritis, giddiness, and other effects. So be careful.
Similarly, there was this kind of hype regarding azithromycin also for quite some time. Like azithromycin is useful in of COVID-19, and
it is totally. This is a totally, yeah.
So because
it was totally turned down.
Yeah, basically it is a new disease, evolving disease, so the different protocols are used at different places. So actually no drug is conclusively proven useful. Forget about this azithromycin and hydroxychloroquine. That is in a nutshell, I would say, right?
So one more this thing that, yeah, there is ivermectin, some anti-retro ART treatment. They are also people trying. So remember that, it should be given. They have their own confirmed uses.
Yes.
So don't give. And especially the azithromycin, which is very effective drug. And if people start using it, that it is a cure for corona, it will create two things, that people will, rather those who are having symptoms that symptoms will be masked, they won't be diagnosed. And secondly, if it is used if it is not used properly, then it may develop resistance. So it's up to all of us, even doctors as well as chemists, to take care that azithromycin should not be prescribed for such type of whims.
Yeah, right. So there are anxious questions from the chemist friends of ours, that like we have told them what are all precautions they should take at the counter. They are saying they want to protect their own family members. Very valid question I have come from. So what are the precautions they should take when they go back home from their shop to protect their family? Suppose they are at the counter and contracted some infection from a suspect, or when someone asymptomatic carrier. So what are the precautions they should take when they go back home from their shop?
First of all, I must say that if you take all these physical distancing principle, cleaning principle, and all that, you need not worry that when you go home, you will be studded with the viruses. Never. But still, your family is also under apprehension. We have to think about their thinking. So, as far as possible, take out your clothes, put it in a different bucket, if possible, use a disinfectant. Actually, it is not needed, but for the satisfaction of our family members, because they should feel that they are being rather taken care of. So keep it in a different bucket. Rather, it should be soaked for say 10 minutes with a known disinfectant or known cleaning solution, even known cleaning powder. No need to put Dettol or something like that. Known this thing. Secondly, you should take a good wash. If you can take a bath with a good soap, it's always okay. But at least all your hands and legs and just like that, we were told in our childhood that take wash while coming into the home. Every time I still remember whenever we used to come in the evening after playing, you have to wash your hands and legs properly. Then only we are allowed to enter the home. So same thing that once you come in the home, just take a good wash, clean your hands and legs and everything properly. Keep your shoes outside and keep your other homites, these clothes, shirt, pant, or whatever you are wearing. This thing. If you are using a cotton mask, put it in this thing for a disinfectant, and this thing. So all these things should be observed. Secondly, but you must tell once you go home all these principles to your family also, just like that.
All this information should be passed on to the family members also.
Yes. Yeah.
Right? If any chemist suspects that his staff member or his family member has got some infection, how can he determine that? But again, actually, this question has come from one of the attendee. But I think that the simple symptoms as you had explained, like mild fever, body ache, or dry cough, sneezing, stuffy nose, all those they can do. Now, suppose there had been one patient or has visited his counter, and the virus on the surface, he was COVID positive. The surface has come on that. So it can remain on that counter. Everything fine. We are taken care by hand washing, using gloves. But is there any specific temperature or humidity on which that virus thrives or doesn't thrive? So in short, the other part of this question is whether a chemist can use air conditioner in his shop or not. Nowadays, the guidelines. Ministry of Health.
Actually, the guidelines are quite clear. If you are at home, especially, or in office, if there is any COVID patient in that premises and he has coughed, then that air conditioner machine should be cleaned properly and used. Because in the heat, I was told that this is a national webinar, and we are rather having some many people from the south, especially the Chennai and Karnataka and Andhra Pradesh, in which the heat is very high. Even in Maharashtra also we are having scorching heat. So not using air conditioner will be a very different thing. So, but as far as possible in your shop, if you are using air conditioner, keep it clean. Make its all the flaps and other things clean with the disinfectant, maybe the sodium hypochlorite, and you should keep your the air should be ventilated properly. Your doors and other things should be open. So all these things we have to take care. So you can use this thing, fans without anything. But as far as the air conditioners are concerned, you have to take care that it should be cleaned daily with a disinfectant, and the room or your shop should be properly ventilated. You can open whenever you open the shop. Keep all the doors, and if there are windows, keep it open. Put a fan. All the inside air should go out and outside air should come in, and then start using the ventilator. There are new types of ventilator which cannot be used at this thing, that HEPA ventilator, HEPA this thing air conditioner, or there are some ACQ air conditioner in which they always filter the air which is coming inside. but the simple air conditioner you can use. And if you suspect, if you're afraid, don't use it. You can use air coolers. The desert coolers or the room coolers are also equally important. Only thing, you have to take disinfectant principle for everything.
The message is that there should be the room or the shop or the hospital or
Hello.
room or shop as ventilated as possible, because if putting in an AC will just recirculate the same air. So even if you use desert cooler, it serves the same purpose. Only the outside air should come and the inside air should go out. Avinash sir, there is one more theory which was going around on the social media, that about BCG vaccination and the incidence of coronavirus. So is there any...
Dr. Rajendra sir, you are a very well accomplished pediatrician. I think you are the better person to answer this. I know the answer, but you just better you tell it about the BCG vaccine.
Yeah, BCG actually it is again based on, as it is. I have said it quite a few times in this talk itself. I will reiterate that it is an evolving disease. So nobody is sure of anything. All the things are hypothesis, theory, and principle. These are the different types when you tell any scientific method. The hypothesis is presumption. So it has been observed that all those who have been vaccinated for BCG, that is vaccination for tuberculosis, BCG is given right immediately after birth. All those in the world, all those countries who have introduced BCG vaccination in their national immunization schedule have a little lesser incidence of corona than those who have abandoned BCG vaccination long back. So this is again an observational study. It is why it is so, or what is the reason, it is yet to come out. But it is an observation that BCG. So, but that does not mean that you should start giving BCG vaccine today, and so people will get an immunity. No. So that is what I want to make this point.
Yeah.
Don't go behind that. This is a theory. This is an observational study. It may be true, but that does not mean that, like hydroxychloroquine and azithromycin, to go and get yourself BCG vaccine.
It's a statistical observation. Yeah.